Hi, I'm Dr. Ron Allen. Thank you for choosing Lasik Plus and me to perform your PRK laser procedure. And I'd like to take the next few minutes to discuss what you can expect during the procedure and then go over your post-operative instructions. So first of all, it's normal for you to be nervous before the procedure. It's just like any other procedure you're going to have. But you have very little to do with this. Basically, the lasers and I fix your eyes, and you just try to relax and hold still. And when I tell you to look at a flashing light, you do that. I'm going to provide you with a Valium prescription to help you with relax if you choose to take it. Just wait till after you check in and go through the consent form. A lot of patients choose not even to use it. And you will be armed with either a stuffed animal or a football to squeeze as well. And before we do anything, I'm going to go over the exact specifics of what you're going to see and hear and feel during the procedure. I'm going to be talking you through it. So this isn't going to be bad. It's just going to be very strange. So many patients think that they have to perform at a high level or they're not going to get a good outcome, and that's just not true. So for instance, the way that we do the procedure is we'll have one eye covered, plenty of numbing drops, we'll have a smooth eyelid holder in, and when I tell you to look at the flashing light for the treatment, that we'll have the tracking system of the laser activated to actually guide the spots that will sculpt your cornea. If you were to become disoriented and you couldn't see the light and you looked away, all that would happen is that the tracking system of the laser would stop the treatment. So there's really very little you can do to mess anything up. The total time to do both eyes with PRK is approximately 10 minutes, and it should be painless. When the laser treatment is completed, then we're going to rinse with some cool water, and then we're going to place your contact lens on. It's going to stay on the next 4 or 5 days. That contact doesn't have any prescription. It's just there basically as a Band-Aid. And then we'll be applying all your prescription eye drops. So you don't need any until your 5-hour nap is over. And then once we've done both eyes, we'll take you over to the little microscope in the laser suite to give us another view and make sure your contacts are sitting just the way we like them. And then we'll send you on your way. And on the way home, after 15, 20 minutes, then the numbing drops are going to wear off, and then the eye is going to get uncomfortable. It's normal for it to be burny and scratchy and watering, etc. You know, before you leave the laser suite, we'll place the sunglasses on to help prevent you from rubbing your eyes when you get home. Just put the goggles that you provided with in the Lasik Plus kit on and go to bed. The ideal thing is just to miss those first couple hours where it's especially scratchy. And after that, you'll be pretty functional. A little later in the video, I'm going to go over the specifics of your various drops. But you're going to be provided a pain pill, you're going to be able to apply ice for comfort, and you're going to have a very dilute anesthetic solution for comfort as well. So if you can't get to sleep, you can use those. Another the question then is, well, okay, that's the first day, but then what's it like over the next 4 or 5 days? And it's interesting. It varies with respect to your vision and your comfort and the light sensitivity. So best case scenario, maybe 70% of people, they'll feel a foreign body sensation. Be very aware of the contact lens in the eye. Even if they were a long-time contact lens wearer, they're going to be much more aware of it. Certainly be light sensitive outside. You have to have your sunglasses on. And as far as the vision goes, often it starts to get slightly better, but then as those cells start healing across your cornea, it usually worsens again. So remember that. It's not a situation where every day after your PRK it's going to keep getting better. Well, the contact lens is on. Really, how you see doesn't tell us much. Patients with very mild prescriptions are fairly functional, but if you've got a really big prescription, you're not going to be seeing well during that 4 or 5 day period. You know, for large prescriptions, seeing 20/60, 20/80, 20/100, certainly it's a lot better than it was before you had the PRK without glasses. But on the other hand, with glasses and contacts before the procedure would be much clearer, but you're going to get there. So not being real functional, you're going to need someone else to drive you around during these 4 or 5 days, and we'll just have to see how you feel. Because maybe 30% of patients, days 2 and 3 will be the most uncomfortable. So remember that. It can go from the first few hours and then feeling pretty good, and there you are on the first post-op or second post-operative day, they're getting burny and sore again. And often if they get sore again, they're more light sensitive, vision's not as good. None of this correlates with outcome, but you just might not be very functional. So you don't want to be making any big plans. If you're feeling pretty good and just a little foreign body sensation, sure, you can go to lunch, you can go to dinner, you can go shopping, but you just can't make any plans. Now, when the contact lenses are taken out, patients are usually much, much happier. Light sensitivity returns to basically normal. Maybe you've got a little foreign body sensation, but you're feeling pretty normal. And the vision is usually functional. The vast majority of PRK patients after the contact remove are seeing somewhere in the 20/40 range, which is good enough to drive and usually good enough to work. And so you're sort of back to yourself. You're not perfect, but you're functional. And most PRK patients will then relate that every day the vision is continuing to get better. But even at a month, the clarity, the crispness is just not perfect. So when you come in to see Dr. Makela, even if he tells you you're seeing 20/20 at a month, you might still be slightly disappointed. You might tell him, yeah, you told me I read that line, but the C could have been an E or the I could have been a T, and I'm still getting a lot of halos at night, and when is this going to get sharper? And basically, quality of vision with PRK continues to improve for even 6 months, but most patients, as you get into the second month, are much, much happier about the vision. It's sort of like the little bit of fogginess or lack of clarity starts to really sharpen up. So just be very patient. The recovery period is just very different than PRK, although the results are very similar. Now, if you say, well, what if my treatment isn't right on? When would you consider doing a retreatment? Again, we want to give the eye about 6 months to stabilize before that we would even think of doing that. Now, let's get back to the drops and your medications. You're going to have 4 medications to take. Usually there's 2 antibiotic drops, and the most common ones for us are ciprofloxacin and tobramycin, but you might receive different ones, sometimes based on your sensitivities or your allergies or some other clinical basis. We may choose to use different antibiotic drops with you. Those are used 4 times a day: breakfast, lunch, dinner, bedtime in general. Another drop will be prednisolone acetate, and that's a steroid anti-inflammatory. It's a milky white drop, and we want you to really shake that drop up before using it every time. And again, in general, that's going to be 4 times a day, although you will take it for a little longer after the contact lens come out, and Dr. Makela will go over the details of that when the contact comes out. And then that's also 4 times a day. And then the 4th drop is called Acuvale, and it's an anti-inflammatory, but think of it as like a topical Motrin. It helps with discomfort, and you're just going to take that the day of your procedure, twice a day, and the next day, twice a day as well. So there's 3 drops. It'll be 4 times a day, and then there'll be 1 drop that's twice a day, but it's just for those first 2 days, and then you're going to discontinue that. Now, we vary when we're having the procedure. So if you have a PRK early in the morning, you're probably going to be able to get in 2 or 3 rounds of all your drops. On the other hand, if you have a afternoon or maybe even early evening procedure, we'll be happy if you get in 1 or 2 rounds of drops. Remember, we put in a complete round of your drops at the end of your procedure. So the first day, we want you going home, going to sleep, don't rub your eyes, and don't worry if you've got the full schedule of drops in for that first day. Now, there are also some other medications we're going to use to help your comfort. First, we're going to give you a prescription for a strong pain pill. Usually we prescribe Percocet that you can take 1 pill every 4 hours. Now, some patients don't tolerate strong pain pills very well. They get sick to their stomach, even if they're not allergic to it. So some will just say, I don't want to have any of those. Others will say, those are too strong for me, but I've tolerated another one. So we may substitute the pain pills, or we may choose not that you just plain don't want any of those. You'd rather rely on Tylenol or Motrin or something over the counter. But we're certainly going to offer you a prescription for that. Believe it or not, ice is amazingly helpful, and you can just apply it in a washcloth, Or frozen vegetables, many people swear by that. Frozen peas, apply it for 10 minutes, take it off. So whenever there's a painful feeling, that's very helpful. We're also going to provide you some what we call comfort drops. Now, pure anesthetic drops, you might think just send me home with those and I'll keep it numb for the 5 days. But anesthetic drops retard healing if you take too much. So what we do is provide you a bottle with artificial tears that are diluted with some anesthetic drops. So those will help. Don't take them more than 6 times a day. It's especially good to take right before a nap. And then artificial tears are helpful. Even if the eye's feeling good or it just feels like something's in the eye, I would take the artificial tears probably every hour. So again, to summarize, tears take very, very often. The comfort drops don't take more than 6 times a day. The pills, the pain pills are 4 times a day. And then the ice, you do 10 minutes and then you take a break with them. And that really should help you with the comfort of your procedure. And remember, we want you going straight home after it and try to just lay down for a good 4 or 5 hours. Now, we're also going to put the sunglasses on, as I mentioned, right after the procedure, and then we want you to get home and put the goggles on. But this is very, very important. With PRK, the ultraviolet of the sun can be very damaging. And so we want you to have ultraviolet blocking sunglasses. Make sure they really do that well for 6 months to a year. If you've got a bigger prescription, certainly for a year. So it's not every time you go to the mailbox, but anytime you're going to be out there for any length of time, you have to have the sunglasses on. And you're going to want them on this first week because you're so light sensitive. But 6 months or a year from now, you won't be thinking about this unless you really make this a point. Also, don't get any water in the eyes while that contact lens is in and the surface hasn't healed. That would really increase your chance of infection. So stay out of pools, stay out of hot tubs. When you do shower, make sure that your eyes are closed. And then, there are some frequently asked questions that I do want to go over. They're just natural, like when can you drive? And the answer is, well, when you're seeing sharp enough to do so. And so the most patients, you do have to wait till the contact lens comes off, and then Dr. Mackala could tell you what your vision is and if you're seeing well enough to drive. If even though you're legally fine to drive and you just don't feel comfortable, then have someone else drive you. When can you wear makeup? Well, we want to wait probably a week because you want to make sure that surface is completely healed over. Certainly not before the contact lens comes out. Another question is, does the PRK procedure hurt? And the procedure itself doesn't. Afterwards, there's certainly discomfort. And maybe a third of people days 2 and 3 will say, yeah, it was very uncomfortable. But the procedure itself is not painful. It's a very easy procedure to go through. In fact, going through PRK in the laser suite's easier than going through Lasik. Can you watch TV the night of the procedure? Well, just see how you're feeling. There's nothing that you're going to do that's going to hurt your eye by using the eyes. It's just that your vision is quite blurry, and most people, certainly won't be seeing the TV well, but you're fine to go ahead and do it. What about mowing a lawn or working in the garden? There you got to for sure wait till the contacts are out, verify that the surface is healed. So I would probably wait a week, and then wear protective eyewear if you're mowing the lawn. If you're out in the garden, make sure you got your sunglasses on. When can you ride a motorcycle? Again, as soon as you're seeing well enough, and you're seeing a pattern here. Contact has to be off. You have to be healed well, probably about a week. Exercise, there's no reason you can't exercise the next day. Again, try not to get sweat in the eyes. If you're doing something where things might fly in the eyes, wear some protective eyewear. And when can you use a tanning bed? There, again, I'd wait a week. And, I talked about how ultraviolet light's very damaging. So whenever you tan, make sure you got protective eyewear on and you've got your eyes closed. What about swimming? Well, at least wait a week, and again, also make sure that surface is healed. What about traveling on an airplane? Now, just like with LASIK, there's nothing specific about an airplane that makes things more risky. Certainly it's drier, but the concern is your surface isn't going to heal over for 4 or 5 days. So we really want you around a week, unless it was an unusual circumstance and you had arranged for another LASIK doctor to be seeing you for follow-up during that early period of time. But usually you want a week before you're going to fly. And then, as I mentioned, how long do you have to wear the sunglasses? Ideally, at least 6 months. and a year if you've got a large prescription. And what about halos? Well, certainly during that 4 or 5 day period, your night vision is terrible. That surface hasn't healed across. So don't get nervous that halos are going to stay like that. They're not. When the contact comes out, you're going to be functional. Usually you can drive, but you're going to have a lot more halos that first month than you are long time. Once we get to the 1 month period, then gradually those halos are going to start declining. But remember, if you have a very small prescription, the halos may only be there for a month or two. If you've got a very large one, it could be 4, 5, 6 months, even though they're declining, but that long before they really, really diminish. I think a big thing to remember is the chance of you having halos worse than you do now a year after your procedure is only 1%. So you're certainly going to be worse for a while, but then they're likely to go completely away. So I think the bottom line here is you're going to be taking a lot of drops. You just sort of have to be patient during these 4 or 5 days where you're just not very functional. And then the next month, you're going to be back to work and working out and things. Things just still be a little blurry, and they're just going to keep getting better. But as time goes on, this PRK is going to come in, and you're going to get the kind of vision that you want. So remember, before we do anything, I'm going to go over everything in detail again with you, and I'm going to take great care of you.